Hi, we're the Convenient Care Association, the trade association for all of the retail health clinics, which are walk-in health clinics located in retail stores, supermarkets, and pharmacies. They can treat anything from acute to chronic care. They're convenient, which is why they're also called Convenient Care Clinics, and they've revolutionized healthcare in America, providing better access at a much more affordable cost, which is great. But it wasn't always like this. You see, at the turn of the century, America was in a healthcare crisis. There simply was not enough supply to meet the healthcare demands of Americans, especially with an ever-aging population. At the same time, most American consumers did not have an established physician-provider relationship or healthcare insurance. As a result of this, millions of Americans were not getting the care they needed, and as costs continued to rise, there was an unjust burden on more and more Americans as well. And if you did manage to get into an emergency room to see a provider, wait times were devastating. But the perfect storm didn't stop there, because at the same time there was a massive shortage of providers as well. But at the peak of this crisis, that's when innovation struck. In the year 2000, to combat the lack of accessible, affordable, and quality care, Minneapolis, Minnesota opened up its first retail clinic. The model was simple. Use nationally certified nurse practitioners and physician assistants in retail settings where the foot traffic of everyday people is higher, and provide primary care. Care that was affordable, accessible, and high quality. The model worked, and over the next 6 years, investors and operators began expanding retail clinics and supermarkets, retail pharmacies, and big box retailers. That first retail clinic, QuickMedX, would eventually become a Minute Clinic. And while it was the first, it was quickly followed by many others. In the year 2003, the Little Clinic is established and opens its first 5 clinics. In 2004, Aurora Health System is the first health system to join the retail clinic journey and opens its first retail clinic, the same year that Minute Clinic partnered with the CVS Corporation. This year, there's the first appointment of a Retail Health Chief Nurse Practitioner Officer, and Retail Health begins promoting advanced practice provider care not only in healthcare, but in business too. In 2005, Ready Clinic opens its first clinic in partnership with Memorial Hermann. Take Care Health Systems would join their ranks as well, opening up their first clinic. And the year after that, in 2006, Fast Care establishes its first clinic with Bellin Health, the same year that Sutter Health and Lindora open up their first clinic in a Rite Aid. This is the year that Geisinger Health establishes CareWorks walk-in clinics, and the year that CVS would acquire Minute Clinics. In future years, more companies would join in, as Walmart begins partnerships with health systems and opens up their first clinic. In 2008, Take Care Health Systems is acquired by Walgreens, Target establishes their first retail clinic, and other retail clinics begin expanding and consolidating too. In future years, Fast Care would expand into grocery stores like Ahold, ShopRite, Meijer, Albertsons, and Big Y Foods. In these future years, Ready Clinic would be acquired by Rite Aid, CVS Health would acquire Target clinics and rebrand them as Minute Clinic, and the Kroger Company would purchase the Little Clinic. This is all as more and more clinics are accredited by the Joint Commission. And while all this is in the years to come, we hold here in 2006 because that's when our trade association first formed, when we all came together. You see, that was the year when former Secretary of Health and Human Services Donna Shalala suggested that there is a need to form an organization that supports these new disruptive healthcare innovations that provide primary care in retail settings. So fall of that year, leaders in the industry came together and convinced other retail operators to join together in forming the Convenient Care Association, a trade association dedicated to pursuing one simple mission: to provide affordable, accessible, and high-quality care to all Americans. And that's what we've done. As we've continued to grow, we've come together on quality and safety standards, switched over to electronic health records, and proven that we are the lowest cost primary provider. This consumer-driven phenomenon exploded in size and in scope. By 2009, we had not only seen a drop in emergency room visits, but had risen to over 1,000 clinics across the country. It was at that point that this national phenomenon had made it so that 30% of all Americans were now within a 10-minute drive of a convenient care clinic. At this point, health insurance companies began to eliminate co-pays for care delivered at retail clinics to encourage more and more people to use retail clinics to get access care where they need it. But we didn't stop there. We partnered with the Healthy Trucking Association of America to expand access to basic primary and preventative health care for our nation's truck drivers and their families as well. 2013 is when we published our first book and started telling our story to others. And by 2014, we began looking ahead to the future of healthcare delivery with telehealth, developing principles on telehealth development and adoption. As our numbers continue to grow beyond 2,000 clinics across the country, we continue to advocate on behalf of convenient care clinics, as well as nurse practitioners and physician assistants. They're leaders in our healthcare clinics. Because nurse practitioners and physician assistants are innovators too, we've been deliberate in having them speak about their role in the healthcare community. This wasn't as widely accepted in 2005, when we were first forming, and we've certainly had our fair share of battles across this country, ensuring that we are able to provide accessible, affordable, and quality care to all Americans. Together, with a unified voice, the industry has not only survived, but thrived. Since founding, we've advocated on behalf of over 400 bills, both state and federal, with over 73 bills we've been monitoring in 2016 alone. But the work goes on, and as our numbers continue to grow, we continue to ensure a united voice in our industry, enhance access for all Americans, and educate the public about the work we're doing, and providers to help them improve their practice as well. And we've been hard at work at producing that material, educational webinars that are CE accredited, and materials that we can distribute to the public to tell our story. In 2006, we helped publish the first retail clinic-focused publication, Retail Clinician Magazine, based out of Drugstore News. These publications have only increased in quality and numbers. But we didn't stop there. To further understanding, we started organizing conferences and weeks dedicated to understanding retail health clinics and retail health clinic providers. The first one was in 2008, the Retail Clinician Education Congress, but many more have been organized since, including our annual Convenient Healthcare and Pharmacy Collaborative. And finally, we continue to conduct studies to prove that we are in fact the lowest cost provider and most accessible provider for Americans everywhere. Since our launch in 2006, together with industry leaders, CCA members have created the most successful primary care clinic model, an industry that will continue to grow and is expected to surge in the years to come, continuing to offer accessible, affordable, and quality care to people everywhere. That's our promise, and we're honored to be a part of this movement.